In order to properly measure the patient's blood pressure, it is important that a pre-assessment is done in order to ensure that the patient has not consumed caffeine or nicotine 30 minutes prior to the test. It is also important to have the patient relax 5 minutes prior to the test and is sitting properly with his back supported, legs uncrossed, feet flat on the floor, arm extended and supported at the level of the heart. Once the patient completes the pre-assessment, the person recording the blood pressure will wrap the cuff around the patient's bare arm, ensuring that the artery line that is printed on the cuff matches the patient's brachial artery. Once the cuff is placed properly, the person recording the blood pressure will place the stethoscope's bell on the brachial artery of the patient and will inflate the cuff to about 180 milligrams of mercury. Once the cuff is inflated to 180 milligrams of mercury, the air of the cuff is slowly released at about 2 to 5 milligrams of mercury per second. During this process, the person recording the blood pressure will listen for the first sound of the heart and will listen until it fades away on the last sound. The blood pressure of the patient will be the milligrams of mercury on which the sounds appeared, the first sound being the systolic pressure and the last sound being the diastolic pressure. If a second reading is required, it is important to wait 3 to 5 minutes before recording the blood pressure again. Once the person recording the blood pressure properly identifies the patient's blood pressure, it is important to tell the patient what his or her blood pressure was.